Okay, Kohnen here, Clinical Director at Growth Through Life Counseling, talking about the warning signs of suicidality in teenagers. 4 out of 5 teen suicide attempts are preceded by clear warning signs. So this is a little bit of good news, and we do not want to ignore those warning signs. We would like an immediate, thoughtful, caring response from teachers, school counselors, parents, adults in the area. We never want to dismiss a threat of suicide as a cry for attention. We can assess that later, but we have to act as if it's a crisis so we can keep that child safe. So some of the warning signs that we want you to look out for are changes in personality, sadness, withdrawal, irritability, anxiety, exhaustion, indecision. Changes in behavior, deterioration in social relationships and school, work, performance, reduced involvement in positive activities. So they used to like to play sports, they don't care about sports anymore. Used to be a straight A student, they're barely pulling A's and B's and not turning in work. Maybe they've had a loss in their social situation, they've lost some friends, they've had a change in a relationship or gone through a breakup. Sleep disturbance, so insomnia, oversleeping, nightmares are all associated with suicidality. Changes in eating habits, loss of appetite, weight gain or overweight, or fear of losing control, erratic behaviors, self-harm behaviors such as cutting or other self-harms, or thoughts of hurting other people are also correlated with suicidality. Some of the major risk factors to be aware of are previous suicide attempts or previous diagnosis of depression or anxiety, feelings of hopelessness, helplessness, guilt, loneliness, worthlessness, low self-esteem, loss of interest in friends or activities they previously enjoyed, bullying or being bullied at school or cyberbullying, disruptive behavior or aggression, high-risk behaviors, drinking, driving, poor decision-making, substance use, recent loss, so it could be in their family, death, divorce, separations, broken romantic relationships, family history of suicide, family violence, domestic violence, child abuse or neglect, sexual orientation, identity or gender confusion, access to lethal means, firearms, pills, knives, or illegal drugs, stigma with seeking counseling services, and barriers to accessing mental health services. Also, if someone seems to continually reference maybe a recent celebrity suicide or musician suicide, that's something we just want to kind of red flag that person is really thinking about that and about that situation and might be a little bit at risk.